I'm Dr. Gerald S, and I'd like to talk to you about vehicle exhaust, air pollution, and going idle-free. What comes out the exhaust pipe of a gasoline-powered vehicle is a whole lot of air pollution, particularly oxides of nitrogen and sulfur, as well as carbon monoxide. And these and other gases can combine under the influence of sunlight to create ozone, which is a particularly troublesome air pollutant gas that causes a number of adverse health effects. If you add in diesel engines, you've now got the added ingredient of ultrafine, very small particles that can act like cruise missiles to absorb these other gases and hydrocarbons that are created and carry them deep into the lungs where they can have adverse health effects. As a health professional, I'd like to tell you a little bit about what some of these adverse health effects are and what the evidence is supporting the link between vehicle exhaust and the health effects. The things we particularly worry about are effects that occur within minutes or hours of exposure. And the people who have high levels of exposure, who may be walking by exhaust pipes, who may be in the house right next to where the engine's running, who may be in the business where you're delivering materials, or the driver themselves can experience these. It's particularly making asthma worse, causing worsening of chronic respiratory disease, what we call acute exacerbations, that may bring people to the emergency department of a hospital or to their doctor's office, and cardiac events, acute cardiovascular events such as irregularities of heartbeat, heart pain or chest pain, angina pectoris, or actually true heart attacks, myocardial infarction. All of these things go up with acute exposures. I'd like to tell you about just 3 examples from a very large body of evidence that supports the link between adverse health effects and air pollution. The first is a study that I believe is called the 6 Cities Study, where 6 different communities in the United States, relatively large cities, were monitored, and where the air pollution levels over a matter of several years were linked with the frequency of visits to emergency departments, doctors' offices, hospitalizations, and deaths due to respiratory disease and cardiac events. And they found an incredibly tight linkage between times when air pollution was very high in these cities and all of these events got worse and people were in the hospital more frequently, and times when air pollution was lower and the events didn't occur as frequently. I think this brings together sort of the whole general population and the effects of general air pollution on them. The second is a study that was done in Los Angeles where they took a group of patients who had known coronary heart disease. They'd had heart attacks already, and they put EKG monitors on them that recorded their heart rate and their electrocardiographic features of each heartbeat. And then they got these volunteers to ride around in a taxi for about 3 or 4 hours while they monitored their cardiac events. And they took them out in the country where the air was relatively pure, and in downtown LA where the air quality was terrible. And they found that when they were in the high pollution areas, they had many more cardiac irregularities, ischemic changes on their EKGs, and irregularities of heartbeat when they were in the clearer air. A matter of a few minutes making the difference between whether those things were occurring or not. And the third study is one where they mapped the frequency of respiratory disease in children. Days missed from school, visits to doctor's offices, hospitalizations in neighborhoods, and they mapped how close each house was to a major automobile thoroughfare. The closer you were to the big highway, the greater the frequency of these respiratory events in children. And the farther away you lived from the big highway, the less frequent these respiratory events were. So those are just 3 examples of how the general population, people with existing heart disease who are at risk for more heart events, and little children can be affected by air pollution. So the bottom line is go idle free, turn off the key, and don't add to the air pollution problem for those right around your vehicle.